Hi everyone, my name is Dr. Debbie Rickeard. I've been a registered nurse for 46 years. My career has taken me through many pathways, including acute care, critical care, and currently I am a nurse educator at the University of Windsor. So I've been teaching 12-lead ECGs, how to do them, as well as the interpretation of them, probably for almost 3 decades. I've done this at Henry Ford Hospital when I was a critical care educator there, and have continued that role at the University of Windsor in their Con Ed department. My main focus has been working in cardiology. I've been an advanced practice nurse working with a group of cardiologists in Windsor. And so part of my role there, I would educate staff how to do 12-lead ECGs and help them with the interpretation. And then currently in my role with continuing ed, teaching them the correct lead placements with 12-lead ECGs. So one of the really important things with doing a 12-lead ECG is where the leads are placed. A 12-lead ECG, if you're not aware, actually takes the electrical conduction system of our heart and transforms it onto a paper. On that 12-lead ECG, we look for certain changes that can indicate, for example, a person is having a heart attack. The heart's not getting enough blood supply, or they have a conduction type of defect in their heart. But the only way that the 12-lead is going to tell us that information if the leads are placed appropriately. The 12-lead, when we compare it, either they are going to get interventions that they don't require, okay, or we are going to misinterpret it and they're not going to get the proper care, and that can certainly impact their outcomes. So it is so important that we do standardize both the education of people who are doing these 12-lead EKGs. And the reason for that is we want that 12-lead that was done anywhere in Ontario, whether it's Windsor, London, or Toronto. We know that the person doing that 12-lead ECG is placing those leads in the appropriate spot. They're doing the correct landmarking. So as a healthcare provider, we can ensure when we are comparing those 12-lead ECGs that they have been done in the same way, that they're reflecting those walls of the heart, that the landmarking has been done appropriately as well. And I think the other part that's really important is not only we standardize where lead placements are, but the education that someone is provided when they are going to be doing 12-lead EKGs, that they understand the rationale for that as well. Because what happens a lot of times is people are busy, right? And it takes time to do that 12-lead ECG correctly. And so they may forget about those landmarkings and just put the leads where they think they may be going. If they understand the rationale, then they understand the importance that each and every time they do a 12-lead ECG, that they have to do that landmarking.